As a doctor, I'm often asked, is alcohol good for you or bad for you? And the answer is yes and yes. We know unequivocally that if you consume alcohol in a modest amount, that it does have numerous health benefits. But I'm not saying if you don't drink that you should start drinking. That's because we also know that if you drink an excessive amount of alcohol, it increases your risk of cancers of the mouth, throat, and esophagus, can cause high blood pressure, cirrhosis of the liver. But on the flip side, a modest consumption of alcohol can decrease your risk of heart attacks by up to 40% and decrease the risk of a type of stroke called ischemic stroke by up to 21%. And there's also a lot of science that says that people who consume alcohol in a modest amount have a decreased risk of developing dementia later in life. Why is that occurring? Alcohol contains powerful antioxidants called polyphenols, and these make your blood less likely to clot. They cut down on inflammation of the blood vessels throughout the body and actually raise the good cholesterol, or the HDL. Now we're talking about a modest consumption of alcohol, and what's that? That's no more than 1 drink a day for a woman and no more than 2 drinks a day for a man. So what's a drink? A drink is really 5 ounces of wine, a 12-ounce beer, or 1.5 ounces of spirits. There's ongoing controversy about whether a modest consumption of alcohol for postmenopausal women will increase their risk of breast cancer. Now this risk is very slight, no more than 1%, so women, you really have to weigh that risk versus the fact that a modest consumption of alcohol will dramatically decrease your risk of heart disease, and heart disease is the #1 killer of women. You want to drink alcohol with meals because that slows the absorption, and never, never drink and drive. For Sherwick Media, I'm Dr. Randy Martin.